It's my privilege to have you here today. We have a very, very special speaker lined up for you, Dr. Lisa Miller. But first, I'd like to introduce Dr. John K. Graham, who's the president and CEO of the Institute for Spirituality and Health. He'll tell you a little bit about the Institute, and he'll have some remarks about this afternoon's proceedings. If you could welcome Dr. John Graham.
I want to welcome all of you here, and I just want to tell you a little bit about our institute and what we do so that you'll be aware of it. First of all, we've been in existence for 60 years, and this is part of our 60th anniversary events. We had a wonderful gathering this morning, and now Dr. Miller will be speaking this afternoon, of course. Our mission is to increase awareness of the role that spirituality plays in health and in healing. When we first started 60 years ago, there was no evidence-based studies to substantiate that, but a lot of people were getting frustrated by American medicine becoming more secularized and the experience being rather sterile, scientific in a hospital setting. So some very philanthropic, mostly Methodists and a couple of Episcopal families came together and others, and they created the Institute of Religion, as it was originally called. We had chaplains trained. We were one of the first in this region training chaplains, and there were hundreds of them. The people came from all over to train in their chaplaincy program. And then the hospitals took it over, and then we had bioethics department there that Baylor College of Medicine took it over, and gradually we've reinvented ourselves in a wonderful way over the years. One of the things we do now is we've had a psychotherapy and faith conference for the last 24 years. About 350 people attend that. It grows each year. We're very delighted that it's well received in our community, particularly among people that deal with mental illness and individuals like psychologists and psychotherapists and social workers and chaplains and clergy. So it's a wonderful opportunity there. We also do a nursing conference. In other words, we are a large part of what we do is education of the public, but also healthcare providers about that role that spirituality plays. But we also do other things. We do research. We've done several research projects. One of them that's been very meaningful for us is we surveyed the Harris County Medical Society. There are 13,000 physicians listed in the Harris County Medical Society. We scientifically, so to speak, surveyed 1,000 of them, sent them out and gathered information from them, those that responded, and found out they had a high degree of spirituality, about what the rest of the community of Houston has. They also told us some surprising things to me. They said they prayed for their patients. About 70% of them prayed for their patients. 50% of them said in the last month they had read sacred writings in their tradition. We also asked them, would you feel comfortable talking to your patients about spirituality? And 85% of them said they would. And we thought that was very interesting. We also asked, do you do it? And turned out only a very small percent, like 10%, actually did it. That fits with, interestingly, with the public. High percentage of the public would love for their physician and them to have a conversation, including their spirituality. But the fact is, patients never bring it up to the doctor. And so we're missing each other. And when we ask, why do you not do it if you're prepared to do it and would like to do it, and what they mostly said was, the doctor said, well, maybe I don't have enough training, but both of them said, I don't want to offend my clients. So that's very interesting. In other words, we're missing each other. So one of our important roles is working with medical students, and we do things to give them permission and teach them how to bring up the subject of spirituality in their talks and why it's important. And I could talk for a long time about that, but I won't. So we do that. That's a research project. And then we also do what we call service projects in the community. So we have education, research, and service. And one of the important examples of that service project is we've been working with the Women's Home and have a 10-week program. Stuart Nelson, who was up here a moment ago, Stuart Nelson has worked very closely with a team of volunteers to create a 10-week program for women who really have devastated lives. They either have been on drugs, alcohol, maybe some of them have been in prison, some of them have been subject of violence in their life. So we've been able to develop a program for them that those who take it have shown spiritual growth and opened their hearts when they even were resistant initially. So it's very special, and we feel we can give that, use that in many other settings. So we're looking forward to doing that. Those are some of the things we do. In this 60th year, by the way, if you did not get one of the books, we purchased books for each one of you, and we want you to have them at no charge. It's one of our gifts to you, and of course we expect big bucks back. No, we don't. We expect you to be blessed by reading those books. We hope you will use them in your family setting, and the reason we're giving them is because of Lisa Miller, which we'll talk about in a little bit.